these social inequalities can be seen along lines of race, religion, ethnic groups, gender, and class, which are already marginalized even before the pandemic. These play along the lines of majority and minority groups, and especially in the case of minority groups, which we speak about groups who don't have a voice, especially so during moments of crisis, can only be studied with immersive, ethnographically inspired data collection. The lesson learned that can be studied across these countries are social resilience on the ground that is actually apparent across countries happen outside of state intervention, outside of state policies, and outside of the more formal links between science academies, universities, and policy making. This can be seen in at least 3 countries, Indonesia, Malaysia, and the Philippines, in which social scientists and academics, and as well as communities, work together to create everyday pantries, to create everyday health access that cannot be provided directly by the state up to a granular village level. And notably, they can do this because they don't rely on the state's intervention to provide those services to people who need it the most. What's important to underline here is the fact that these resilience occur in spite of the presence of the state, which means that if we think about connection between science and policy making, we need to think about what kind of sciences are we mainstreaming into policy making, as well as how we can learn from these lessons on the ground in which people, ordinary people and academics without funding are actually moving resources to protect the most vulnerable. And with the pandemic, especially in countries where state responses has been uneven, in which perhaps local provinces, local governments and states are responding to community crisis much more effectively than the state, there is a closer connection between policymakers on the local level, whether village, provincial, or regency, with those actually mobilizing resources on the field. This way, several areas can be on lockdown based on community initiatives, much faster than the top-down approach that the national government can provide up to a village level. When I say that these kinds of research, mapping which kinds of communities are actually finding ways, innovative ways to self-organize, when they're marginalized, I do not mean that epidemiology or public health are less important. What I mean by mainstreaming is that giving insights into the pockets of the regions, pockets of rural areas, and also peri-urban areas in which vital workers are actually the highest in amount, alongside the kind of large-scale surveys that inform policymaking and health policies in a macro way. These both approaches needs to converse with each other and complete each other in terms of informing policymaking.